Next, we will have Dr. Tucker Edmonds. He is going to be talking about the history of vaccines and the reason for current mistrust of the vaccine. Thank you, Dr. Tucker Edmonds. Go right ahead.
Thank you so much. I'm going to share my screen, everyone. Good morning. Thank you, Representative Summers, for inviting us here for this opportunity and for the Indianapolis Medical Health Coalition. I really appreciate this opportunity. So I'm going to share my screen and I'm going to jump right into this presentation. I just want to make sure that everybody can see that. And we'll go from there. All right. So today what I want to talk a little bit about is who has the body, medical apartheid, racial malpractice, and a pandemic of mistreatment. And I am going to kind of go through this in about 10 or so minutes and kind of give you some historical background and allow for folks to think about where these issues of vaccine hesitancy emerge from and how we can think about them across time and across space to kind of move forward in response to them. So what my goals are for today is I'm going to define medical apartheid more broadly for you. I'm going to expose the continued model of racial discrimination as a form of malpractice. I'm going to outline a history of mistrust and abuse, especially in marginalized and racially vulnerable communities, and theorize a logic of continued suspicion and hesitancy. I called this presentation who has the body? Because for those of us who are in the African-American community, we know that that is a typical question that is asked when African-Americans are going into systems or spaces, who has the body? And I wanted to kind of take that question and think about who can be trusted with the Black body, right? And how we think about the ways in which those questions shape and in many ways articulate the relationship that we're going here. So I wanted to define some key terms for all of you who have joined us this afternoon. First of all, I want us to think about medical apartheid, right? And this is social policies and practices alongside medical systems, services, and institutions that provide different and less equitable care and medical options to marginalized groups, right? So this is the broader category that we live in a medical apartheid system, that since African Americans have been in this country and have been experiencing medical care and medical treatment, we have been living under a medical apartheid system, right? Where there is less access to care, there is less quality of care, and the short and long-term outcomes are lesser and less efficacious for Black and brown folks, right? So this is a medical apartheid system. That's one term that I want us to understand. These other two terms are related to a subcategory of medical apartheid. One is medical racism and scientific racism. These are the pseudoscientific, right? The unfactual, not true beliefs that empirical evidence exists to support or justify racism or racial inferiority or racial superiority, right? This is the idea that there were medical facts or scientific facts that supported the idea that Black folks were inferior, that Black folks were less intelligent, that Black folks had different kinds of skins or different kind of skull or cranial sizes, right? This is medical racism and scientific racism. And this is the idea that racist discourse impacts the logics of science and the delivery of medical care. And medical racism and scientific racism, even though it has begun to be disproven, right, and has been disproven over the last 70 or 80 years, it still organizes and shapes the medical apartheid system that we live in. And I'll talk about that when I look at some of the studies that support that. And then the last term that I want us to think about is racialized malpractice, right? And this is that the care of and the studies on Black and racialized bodies are marked by a blatant disregard of medical ethics and accepted quality of care standards, right? So this is the argument that even when we are using medical ethics and quality of care standards that Black patients and Black and brown and poor patients do not receive the same kind of care, that those medical ethics are flouted, those quality of care standards are ignored, and therefore they are experiencing, as I argue, racial discrimination is understood as a form of medical malpractice, right? And we can look at what happened in 2020, but we can look at what's happened throughout the history of African Americans and their relationship to the medical system. So I want to go through relatively quickly a little bit of history, and I'm sure that many of you all already know this history, right? And so I want to kind of move through it in a way that will allow for you to kind of look at this, but also be able to move forward with it. If we look at it from the very beginning, Black folks' bodies were instrumentalized and were used to support the enslavement or the production or the creation of the medical system or the medical academic practice, but they were never used or were ever never taken care of in any particular way to protect their interests or to provide them safe and full care, right? From the beginning of our time here in the United States, from the enslavement auction blocks, doctors were there to inspect and to look at Black bodies in order to see if they were fit for labor and service and work. And even the early medical experimentation by J. Marion Sims, who was the president of the American Medical Association and was also the president of the Gynecological Association in the late 1800s, he did unconsented experiments on enslaved Black women and enslaved Black children. So from the very beginning, Black bodies were taken advantage of by medical practitioners, were experimented on, and were disregarded from the very beginning of our time here in this country. But as we move on, and then we just move forward just a couple of decades forward from Dr. Marion Sims, we look at Indiana as the birthplace of eugenics, right? And I want all of the folks here to know that we had one of the earliest eugenics laws in the country, right? Which allowed for the medical complex to selectively define who were the human races and the groups of people that were allowed to procreate or reproduce, right? It was an act that was created to prevent procreation of confirmed criminals, idiots, imbeciles, and rapists, right? This is 1907, folks, right? And this eugenics was what was really created the foundation and the birth of eugenics that was used in Nazi Germany, right? So right here in Indiana, we were the testing ground for eugenics that began to not only impact the ways in which we treated marginal and vulnerable communities, but this eugenics language was used to demonize and to very poorly treat Black and brown citizens at that time, right? Black parents were demonized. There was the increased incarceration and placement of Black folks in mental hospitals during this time, and Black women were forced to have sterilizations or the removal of their reproductive organs in order to create a system where we could selectively determine who was able to procreate. And there was even at this time in 1915s, the selective killing of Black infants that were seen to be defective and were thought of as going to be a problem in the continuing evolution of the human race, right? I want you to know that it was in 1908, as a result of these eugenic policies, that the first Black hospital was created here in Indianapolis, right? So we think about Lincoln Hospital in 1908, that was as a response to these practices and these projects that were limiting and denying the rights and the abilities of Black folks to get full care, right? Because Black physicians were not allowed to practice at these other hospitals. Lincoln Hospital created a space for them to do that, right? I'm gonna keep moving on. If we move forward in time, all of you know about the Tuskegee syphilis experiment, right? And so again, this Tuskegee syphilis trial and experiment was looking specifically at 1932 in Macon, Georgia, lied to 600 poor Black men who had syphilis, and the study looked at the progression of that disease, even though at about 5 and 10 years into the study, there was curable mechanisms of penicillin that could have been used. public health officials at that time characterized these Black men as intellectually inferior, degenerate, and at the mercy of powerful sex drives. This is a quote from the public health officials in 1932. This language of pseudoscientific claims were used, right? That Black men were degenerate, that they were inferior, that they had these powerful sex drives, even though over 2/3 of the participants of the Tuskegee syphilis trial had non-venereal syphilis, right? So they did not have syphilis as a result of sexual encounters, right? And so again, these are the problems and the projects that emerge as a result of this. The participants and their families have never been fully compensated for their losses. There was a $10 million out-of-court settlement in 1975, and as a result of this trial, the Tuskegee syphilis trial, we created the National Research Act of 1974, right? So many of the doctors on our call will know that this is what created the Institutional Review Board, that you have to get consent for folks engaging in trials and things of that nature, that you cannot do trials to children or to prisoners and things of that nature, right? That people have to be able to consent. But this is, again, the long history of why African Americans and Black folks are very questioning and concerned about this, right? I have 2 more slides that I want to get to, folks, right? Stolen bodies and stolen futures. These are images, again, of the ways, even after the Tuskegee syphilis trials, that we see that this went on throughout time and history, right? Throughout the late 19th century and the early 20th century, medical schools in Baltimore, Alexandria, Norfolk, and Richmond, and throughout the country were stealing Black bodies from graveyards, graveyards to do medical experiments and treatments, right? To test these things out. Again, you have the picture in the middle of Henrietta Lacks, whose cells were used without consent and were taken unknowingly and harvested for decades of medical research, right? That played out, right? And then on the right of my slide, you have the sterilization of women, and Black women particularly. By 1940, you all, over 100,000 women had been unlawfully sterilized, with the majority of them being Black and brown women in this country, right? So we have a sense, again, of why there is this vaccine hesitancy, why there are these questions about how they have been applied to Black and brown communities, and why we have a real question about who can be trusted with the Black body. On this last slide, I wanted to just look at that there is a continued pandemic of mistreatment, right? And so the reason that we are having this conversation today is because these are not just stories of a historical medical apartheid or historical racial malpractice. These are issues that persist into our current moment, right? The unethical experiments on Black prisoners, Black and brown prisoners. There was a study done in 2000 by the University of Texas. There was another study done by Stanford in 2007 that many of the medical experiments in prisons across this country are being done without consent and are not following that 1974 IRB law that was created in light of the Tuskegee syphilis trial, right? So that's prisoners, Black and brown prisoners. We all know about the 2016 study that was done on pain around Black and brown folks, that in this study that half of the trainees and the folks that were surveyed in this study still felt that Blacks had thicker skin than white people, Black people's nerve endings were less sensitive than white folks, and things of that nature. And then finally, in 2018, there was another study that shows that we are living in really medical deserts, right? Where folks do not even have access to culturally competent care, that they cannot find doctors that will give them care, that speak their language, that understand the racial and ethnic issues that they are facing. And so all of this, folks, and I know I'm out of time, creates the conditions under which African Americans and Black folks have a sense of hesitancy. And so we need to read this hesitancy within the large frame of what has happened over the course of the last 200 years of African Americans and their relationship to the medical industrial complex. And therefore, we have a responsibility to give them the most up-to-date information. We have a responsibility to confirm with them that they're going to get safe and thoughtful care, and to provide them the knowing information and full information that they can use as they decide which vaccine to use and how to apply it in their lives. These are the questions and the issues that we're facing right now.